So I'm going to kind of transition from that to a little bit about what our current crisis is and how we can build immunity and engage in health. So obviously, we can't go very far these days without hearing something about coronavirus or COVID-19. It's a pandemic. It's unprecedented. It's affecting everyone. And my blog article on drshad.com, I talked about how this is an opportunity for us to really recognize how we can really come together in a way that we never have before, no matter what background we're facing as humanity. This is highly infectious, it's virulent, it can cause, as you know, acute respiratory distress syndrome, as well as a cytokine storm, which can be deadly. One of the ways that it works is that it actually binds to ACE2 receptors and it goes into the cells. We're learning every day more and more, and we're all humbled in the medical profession and healthcare profession about how this works, what does it mean? And then as any virus, it basically starts reproducing viral proteins and then releases this mature virus. And you can read more about that. Really the best thing we can do right now, and it's, you know, as you can see, we have a lot of resources through the University of Arizona Health Sciences that talk about this. But as you know, it's really that social or really physical distancing, right, to avoid exposure, and then we can just build our immunity. So how can we build our immunity? Just before I kind of talk briefly about this, and we're going to go to questions. I really advise everyone to consult with their physician. You can also consult an integrated medicine physician on the University of Arizona Integrated Medicine website. There are resources for this, and I've drawn upon some of those for this presentation, and you can access those directly. Remember that there's very little clinical evidence about COVID-19 at this time, so we know very little about it. So what we're sharing right now in terms of what you can do to build your immunity is really based on what we know in general about viruses as well as health, and some preclinical evidence that started to being developed, but we have a ways to go. So really the focus should be on the public health measures. So some of the things that you can do to build your immunity, and this is something we finally have a chance to do in a meaningful way because we're trapped at home in a way that we haven't had before. We've got our coworkers with us. A lot of us refer to our family members and kids as coworkers. It's really trying to get adequate sleep, okay? Melatonin levels are one of those things that have actually been seen to potentially be, again, we're starting to learn about this, protective in children for one of the reasons why they may not be getting the infection as much as adults, obviously, is because of melatonin levels. So getting adequate sleep is actually important. It's not just for the coronavirus, but in general for your health. Taking time to reduce stress, and this Wellness Wednesdays endeavor that we initiated here will give you more tools in terms of how to do that. There's apps that talk about meditation, there's mindfulness, there's many different ways of meditating, and even just taking time, a few minutes to relax a day and reflect is really powerful. As well as just being active, you know, getting up and moving. And now we're all a captive audience, we're talking, we're interacting, but it's a beautiful day, as Allison mentioned today. On the forecast, we should take advantage of that and go outside, even if it's just a few minutes to walk. As well as some of the other general principles is eating real food and eating more plants, because the phytochemicals, the plant chemicals, are very protective against a host of diseases. So some of the things I advise is to remove unhealthy foods, you know, remove refined sugar as much as possible, limit it, refined grains, hydrogenated oils. These are things that are additives that are a big part of the processed foods that make a big part of the standard American SAD diet. Excess animal products and saturated fat, as well as anything processed I mentioned, and also looking at soda and even diet products. A lot of times people would be surprised to know that the products that say diet or low fat actually are worse for our health in a lot of ways. The low fat products tend to be higher in preservatives and simple sugars that contribute to obesity and diabetes, high blood pressure. The dietary products which have non-nutritive sweeteners like aspartame, for example, has been shown to be toxic to our microbiome and also to increase our risk for diabetes more than regular soda. So for studies where they looked at soda consumption, for example. So I would avoid those products and eat more real food. Also, I can't emphasize enough how important it is to really clear your mind and connect with your heart and be positive and be well and live well. And that, what does that look like? Well, it means taking a break from the 24-hour news cycle, right? It's actually going for a walk. It's doing something that doesn't involve this inundation of information overload, which we always constantly are are swimming in. And making a routine every day, right? It's really easy when we have more time to ourselves at home to just kind of become complacent and not have any schedule. But I find that having a schedule actually makes a big difference. And really taking time, even though we're physically distant from each other, to invest in meaningful, authentic relationships. One of the studies that came out of Harvard University a few years back showed that the single biggest contributor, and they looked at thousands of people longitudinally over time, the single biggest contributor to health outcomes was whether or not the people in the study had a meaningful, authentic relationship, and not necessarily their cholesterol level or any other health factors. So eating more phytonutrients in the form of plants, eating real foods, and eating the rainbow of all the different foods, nuts and seeds, using healing spices like garlic, onion, cayenne, ginger, turmeric, cinnamon in foods, eating raw nuts and seeds. These are things that build our immunity. Remember, the microbiome is basically 90% of who we are. And well, the way to feed that is also having fermented foods like miso, kimchi, sauerkraut, tempeh, yogurt, eating fiber-rich foods, eating prebiotic foods, as well as if you're going to take a probiotic, to have multiple strains. Some specific supplements that we're starting to learn about that contribute to health that we've known about for years in terms of building immunity. These particular ones block ACE2 receptor binding in vitro in some cases that we've seen, and we're learning about whether how much this applies to coronavirus. It's astragalus, quercetin, and vitamin D3, so you can look at your vitamin status there. Also, things that inhibit viral attachment replication, elderberry, zinc. These are things that have been around for a while and help us protect us against cold viruses, other types of coronaviruses, right? The ones that have been around for a long time without major problems. Vitamin D, other ones that kind of reduce the inflammasome activation, which is kind of that cascade that leads to a lot of the negative effects. Or vitamin C, melatonin, which you can either get in the form of sleep, obviously more sleep having that, as well as supplements. Incidentally, pistachios, which are one of my favorite foods, have more melatonin per gram than any other food. So I enjoy snacking on raw pistachios. Garlic, quercetin, green tea, curcumin, turmeric, a lot of things that we may have known about. So I advise you all to consult your doctor, talk about some of these supplements, but these are some of the ones that that I utilize in my practice, as well as I'm advising my patients. And I look forward to hearing your questions, continuing to stay engaged with you through this, as well as other opportunities to connect through other events and activities we'll be doing. I'm also available for consultations with folks as well. Now we're all doing everything virtually. So with that, I'm going to go ahead and stop sharing my screen and turn it over to Allison to help.